Health governance in our country is a process of shared responsibility between both the national and county governments as per our Constitution 2010. Therefore, in the process, county governments and their readiness to respond to new imported cases of infection will also equally largely determine our national readiness to reopen the country as a whole. And this is because the nation is the sum total of our 47 counties. And if the counties have met the necessary thresholds, then the nation as a whole will be ready to reopen.
Counties will work closely with the Ministry of Health to ensure testing of all individuals meeting current cases definition of COVID-19 as well as other risk population prioritized for testing. Enhanced screening at county boundaries. Counties will enhance surveillance activities, including 24-hour surveillance. We propose that a multi-agency approach is applied on disease containment through improvement of testing capacity, contact tracing, and enforcing the social vaccine mechanism.